Whether you suffer from an upset stomach after you eat or you have constant unexplained bloating, you're not alone. Millions of Americans suffer from gastrointestinal problems. Joining us today is Dr. Navaneethan with the Orlando Health Digestive Health Institute. Thanks so much for being here with us.
Pleasure to be here. Thank you.
So let's start with the difference between IBS and IBD.
So IBS is irritable bowel syndrome. Basically, patients have irritable bowel. So anytime you eat some foods, can trigger some symptoms like bloating, gas, abdominal pain, diarrhea. While IBD is inflammatory bowel disease, which is basically actual inflammation. So you actually see damage to the colon or your small intestine because of some genetic factors or other factors which can happen. And they actually have real damage to the bowels, which actually can impact their life quite a bit.
So IBD is much more serious.
That's correct. It's a much more serious condition than irritable bowel syndrome.
So the first course of action usually is to try to control the symptoms with some dietary changes. What are those and what foods should people be avoiding?
So there is something called trigger foods in patients with IBD, and one is a pro-inflammatory food. So trigger foods are, for example, if you eat too much of insoluble fiber, for example, apple with the skin on,
right.
Broccoli, cabbage, things like that.
And that's the stuff that's supposed to be good for us,
I know,
right?
But not for an IBD patient. These foods can actually trigger symptoms because they actually have high amount of insoluble fiber in them, and they can cause bloating, gas, and pain. There's some other food called pro-inflammatory foods, which actually can promote inflammation and can actually cause damage to the bowel wall. And also use of artificial sweeteners in your drinks and things like that, or additives or any kind of a processed stuff can also cause inflammation. Unfortunately, they're everywhere.
You are an international expert when it comes to IBD, and you've done research, you treat patients. There are a lot of new tools out there for you to help people get better. What is Orlando Health doing to advance the cause and help bring better care?
I mean, we have advances of all the treatments you can imagine in IBD. For example, we do a trial supported by the NIH, National Institute of Health. We are trying a new exploratory way to manage IBD. It's called hyperbaric oxygen treatment in the chamber. We're using that as an option for treating severe ulcerative colitis patients in the hospital. So we're using that as part of the trial. We also have access to around 20 clinical trials with other advances like phase 2, phase 3 clinical trials. On top of it, we can offer the most advanced endoscopic treatment available anywhere in the world, just because of the access we have in terms of resources. So we offer techniques where nobody else offers in the state of Florida, or very little in the United States as well. So we have all the advances you need, starting from medicine, endoscopic treatment, and surgery if needed at this point of time.
And if you would like more information, you can visit orlandohealth.com/DHI.